Hello again. I'm Jason Renault with the Alternative Mobile Services Association and AMSA Talks. Today we're with Dr. Leah Pope of Columbia University. Leah, you are the first person to appear twice on AMSA Talks.
Glad to be here again.
Well, we're glad to have you. We're going to talk about a survey you're doing. But first, tell us a little bit about you and how you got to this work.
Yeah, thanks. Really glad to be here. As you said, I'm at Columbia University. I'm a research scientist there, along with the New York State Psychiatric Institute. I've been there for about 5 years, having come from the Vera Institute of Justice, where I ran training and technical assistance and research around police and alternative responses to people with mental illnesses. And so my work really for the last 15 plus years has been in the intersection of mental health and criminal justice, increasingly focused on crisis response and alternative models.
Well, fantastic. And you've selected this field for a reason. Can you tell us about that?
Oh, good question. I, like many people, sort of have taken a circuitous route to finding what I'm really interested and passionate about. I spent a lot of time as a young person with my family in with foster care children.
Hmm.
And so I really thought initially that I was going to focus on foster care youth and sort of pathways from foster care to criminal justice systems.
Oh.
And I started my dissertation work in grad school focused on that, but then really became more interested in broader systems just beyond foster care and really thinking about the role of mental health and mental illness in the criminalization of people. And so sort of have followed different steps to get where I am, but that's where it started.
There's a lot of mystery about that pathway from foster care to incarceration.
Yes, I think
Terrible, terrible
still
story.
not well understood in terms of kind of um, we know it happens, but how to kind of do prevention in a more meaningful way.
Hmm.
Yeah.
Well, tell us about your most recent project.
Great. Well, we've had a number of things in the works. We've recently completed a study of 988 in New York State, both leading up to the launch of 988 and then post 988, sort of how 988 was unrolling in three different counties in New York, and really trying to understand what were people's hopes for 988. And then once it was implemented, what did it look like? Calling it at the implementation stage, how were programs staffing their lines, barriers, facilitators, things of that nature, and really trying to get a sense of how can a resource like 988 be an alternative to traditional sources of criminalization for people with mental illness. So we've wrapped that up. We have a number of other projects in the works. Most of my work today is in collaboration with Michael Compton, who's also at Columbia University, and Amy Watson, who's at Wayne State University. We have a randomized controlled trial of crisis intervention team training underway. We also have a project around workforce for crisis response
Hmm.
that has been really interesting to really delve into sort of solidifying the core competencies for community behavioral health crisis responders. So that's been an exciting piece of work.
We're going to have you back as a third time for the workforce survey when you get that
Yeah,
done. That's really important work. That's the question on everyone's mind in mobile crisis constantly is, yeah,
absolutely.
who are we looking for here?
Exactly. Yeah. So we're trying to do some work in that space that I think is really exciting.
Well, tell me about the new one.
Okay, so really, why I wanted to talk to everyone today is about this national survey of mobile crisis programs that our team is launching. As I mentioned, I work closely with Michael Compton and Amy Watson, as well as on this project, we're working with Dr. Matthew Goldman and Preston Looper, who are well known in the mobile crisis space. We have funding from Pew Charitable Trusts to do a national survey of mobile crisis programs, and that is going to be launching December 1st. And we are defining mobile crisis broadly very intentionally.
Good.
So we're including behavioral health provider mobile crisis programs, as well as law enforcement-based co-responder programs, alternative or community response programs, and then also the mobile response and stabilization services, which are usually youth-specific that have been
Mhm.
rolled out across many places in the country. Um, so yeah, this is a national survey, as I said. Um, as many people listening may know, there was a survey done a few years ago that surveyed about 500 programs across the country. And we are relaunching with a revised survey. We're hoping to reach as many programs across the country as possible. And the reason we're doing it is really to address the gaps that remain in our knowledge about mobile crisis in the United States. So, I think many listeners would agree there's a lot of attention on the crisis system and the someone to respond element of the continuum. And that is really exciting and something I think many of us have been waiting for to get this attention for a long time. And yet we still really don't know many things about what constitutes a mobile crisis program. And when I say that, I mean, what constitutes the team? What kinds of calls do they respond to? Who dispatches them? Who has oversight? Who's financing them? And so this survey is really designed to help fill those gaps in a more meaningful way. And I think, there are good reasons for those gaps. Some of that is due to the rapid expansion of mobile crisis over the last few years. And some of it's just due to differences in terminology, lack of definitions or shared definitions of model types across the country, given that there's so many communities who are implementing things in different ways. But I think this survey is really an attempt to address those gaps and think about, you know, when we have lack of standardization, it makes it really difficult to compare programs, and to really know what works best and under what circumstances. Are we really talking about the same thing in different communities when you say mobile crisis and I say mobile crisis? So our survey is one effort to try to think about how can we develop some shared understanding about what different programs are, and then using that to think about, now that we can document what these different models are and where they exist in different places across the country, do we really have the right mix of services for people to meet their needs?
Yeah, it's so important because of that final point that you have a big tent here and you look at
Yes.
a lot of different programs in a lot of different communities. And
Yep.
also, the programs are on a different developmental scale. So you might have a program that's really young and still struggling versus a program that's mature and has high service numbers. And we'll include the link to the older survey that you did in the narrative box below this video in YouTube and the newsletter. So, how do you get started with this? You have to segment it somehow.
Yeah, so we've been planning for many, many months. This is lots of collaborators in the mix, and we've thought about our strategy in a number of ways. So we're going to be doing national dissemination, obviously, through organizations like you guys and others that we're working with to reach as many programs as possible. As you well know, different organizations speak to different programs, and so we're really trying to tap into all those different resources. We're also working with a handful of states. We've been working with 5 states for the last several months to sort of get a head start on figuring out what teams even exist in the
Hmm.
state.
Hmm.
Um, as you know, this information often is not centralized anywhere, even though there are several great organizations in the field that we collaborate with who have started to document these teams in a
It's
more
daunting.
meaningful way.
It's daunting.
It's really daunting. And so we are lucky enough to have a handful of state partners who have really invested in this project with us, because they want to have a better sense of what's going on in their states. And so the hope is that at least in those states, we'll get do sort of a deeper dive that will allow for more in-depth analysis on the back end for those states. And our hope is that even if you're not in one of those states, you'll be able to look at the state profile in addition to the national report and say, my state is similar to this other state in these ways, and therefore there are lessons to learn from that in-depth analysis of those particular states.
Yeah, I think you'll see that some states really have spent a lot of energy and thought and passion on this, and some states just are barely starting.
Yeah, and I think there are really good reasons for that. Different states are in different places, and certainly within states, different communities are in different places. But I think the idea is that if we can better document them, and really show that range of model types and how's the staffing working, what are the partnerships these programs have, how do they do training, that it becomes much easier for programs and states that are on the front end of this process to think about what's feasible for my state or my particular community.
Now, are you going to include co-response teams?
We sure are including co-response teams. So we are including sort of what I think of as traditional law enforcement-based co-response teams. And then, there are many different configurations of co-response. And so some of those might be categorized in our bucket of alternatives. But yes, we want law enforcement based co-responders and other types, whether they respond together, separately. We very much want them included in the mix because we know they're similarly growing in lots of places.
Is this steps towards a definition of what mobile crisis is?
Yeah, so that's a great question. So, SAMHSA came out with their model guidelines and included definitions in those guidelines. And we have used those definitions in this survey for the most part because we are trying to standardize, what's being used across the field. Um, I sort of see the definitional issue in two ways. We are setting out definitions that at the front end, when we're going to ask people to select which best characterizes their program,
Mm.
even if that's not the term they use,
Hmm.
because we know people use lots of different terms. And then once we have the information from the survey, the hope is that we can refine those definitions or say, you know what? Actually, this definition shouldn't be how we have it based on what we learn teams are actually doing.
Yeah, I've talked to hundreds of teams across the country, and I really have not found any team that is the same as an
Yeah,
adjacent team.
right.
They all
Yeah, and
have some variance.
yes, and I think I'm sure we're going to find all those variations, which is going to make the survey overwhelming and exciting. And yet, I would kind of like say that even so, even with the variation, there is value in coming to some shared understandings of types, models, definitions, so that people can have conversations and know, are we talking about the same thing or not?
You've got a lot of partners in this work.
Yes,
Can you tell me about
we
some of
do.
them?
So yes, we have a number of partners who are working with us on this survey. As I mentioned, this is a collaboration between Columbia University and Wayne State University, and Dr. Matthew Goldman and Preston Looper, who are both well known in the crisis response space, are serving as consultants. We also have our project manager, Matej Vor, who has been working with us for the last 6 months to really get this survey up and running. So that core group has been refining the survey and really doing the legwork to get us to our December 1st launch. But we've also been talking with lots of different organizations across the country to really help us think about the survey. What sort of questions are we asking? How do we best disseminate, reach your membership? So those are organizations like AMSA, Center for Policing Equity, Fourth Branch Institute, the International Crisis Responder Association, NAMI, many more. And, it's been really great to see people are excited about this and want to help get the word out because I think there's sort of a shared desire to have more data about what's going on at the landscape level across the country. I'll also say we're working closely with New York and California Illinois, Michigan, and Ohio. And so we have partners in those states who have been really great supporters of this work. And hopefully we'll get to do a real deep dive in those states.
And those will be the five pilot states that
Those
you're
will be the
looking for.
five.
So in
Yeah.
the survey link that is adjacent to this interview, people will be able to go, they don't have to be from California or Michigan.
They do not. I hope everyone, we have a wide reach. This is going out nationally on the same day. So, regardless of what state or what program you're in, you can click on the link. You will be directed to, you know, the site and you'll be able to fill out the survey.
That's great. I'm so glad you're doing this. It just feels like wandering in the darkness much of the time, trying to figure out what the hell's going on out there. Every time I call someone, it's something different.
Yeah. Yeah. No, we're really excited. I think the level of enthusiasm really suggests that there'll be a lot to learn and that hopefully we'll have high levels of participation.
Well, and thank you to the Pew Foundation for seeing that this was a good idea and coughing up some cash to make it happen.
Absolutely. They've been great supporters of our work and really, great partners in thinking about the best way to do this.
Thanks, Leah. We'll talk to you
Thank
again
you.
next time.
Great. Thanks so much.
Okay. Whoop. Nope, don't do that. Cancel.